The next category of people that we look at are people with, say, obstructive sleep apnea or central sleep apnea, people with high blood pressure, people with anxiety, and people with panic attack. And with this group of people, relaxation is absolutely paramount. Because if I have, say, somebody with anxiety, when I have them bring their attention off onto their breath, it sometimes can make them anxious. So as a result then, the exercise that I would often tailor to those individuals would be exercise number 2. It is reduced breathing, but I would see how they go with it. You know, if they're able to master reduced breathing and sustain the air shortage, great. Now, of course, I have to bear in mind that people prone to panic attack, when I have them reduce their breathing, I'm having them create this need for air. And this is synonymous with how they feel during a panic attack. During the early stages, they feel they're not getting enough air because there's a conditioning that has happened over the years. And over the years, every time they've had a panic attack, they've felt this need for air. Here I am now asking them to practice an exercise which is also creating this need for air. But there's something positive from practicing this exercise, in that when you gently soften and slow down your breath to create that need for air, you're teaching your body that an air shortage is fine. You're also, of course, bringing down your breathing volume to physiological normal levels. And at that then, the cushion between stress and inducing a panic attack, you're able to sustain greater stress before it brings you into panic attack, because of course you've got normal levels of CO2, and with that you've got greater dilation of the carotid artery to the brain, and you've got improved blood flow to the brain and improved oxygenation. So people with obstructive sleep apnea, we don't have them hold their breath because of course they're already holding their breath during their sleep. And you know, if you have obstructive sleep apnea, there may be a tendency towards higher blood pressure. So again, we don't want to do breath holds there. So with obstructive sleep apnea, we concentrate on relaxation, and especially if there's sleep disorder breathing, insomnia, obstructive sleep apnea and snoring. The emphasis is on relaxation and gentle reduced breathing for 15 minutes before we go to sleep. So person with obstructive sleep apnea, of course I encourage walking, partially because with some people with OSA, you know, they can be overweight. And if, for example, that the neck size is increasing in circumference, the neck will only grow outwards for so far. And after a period of time, it then starts growing inwards. And when it grows inwards, then our airway size is getting smaller. So we also need to be cognizant of the fact that, yes, we do want bigger airways, but of course we also want to bring down breathing volume back to normal, because if you have, or if you're prone to obstructive sleep apnea, the Bernoulli principle that, you know, if you can imagine that the upper airways is a collapsible paper straw, and if I put a collapsible paper straw in my mouth and I suck on it, I'm going to cause the inner walls of the straw to collapse on themselves. So somebody who's prone to sleep apnea, think of the upper airways, the throat area, etc., as a collapsible paper straw. And as they go to breathe air into their body, they're creating a negative pressure, which in turn is causing the inner walls of the airways to collapse. And then, of course, once the airways collapse, the more the individual tries to breathe, the greater the negative pressure created as they want to take air into the lungs, and it continues with that collapse. So basically, these people, they'll hold their breath until such point that their oxygen saturation drops to partially awaken the brain, and then they're taken out of their deeper sleep, and as a result, then they resume breathing and resume snoring until the next point that they hold their breath and the cycle happens again. So you could have somebody with obstructive sleep apnea that could be holding their breath for 10 to 40, 50 times per hour. And each time that it's happening, it's taking the person out of that deep sleep. So therefore, of course, that the person wakes up exhausted, not to mention the stress on the body of the involuntary breath holding that's been happening throughout. So people with high blood pressure, we also use gentle relaxation, gentle reduced breathing, and walking with the mouth closed. So taking into consideration obstructive sleep apnea, anxiety, panic attack, high blood pressure, we can include in there diabetes type 1. We can include people with cardiovascular issues. You know, always go lightly. So the exercises then that you will be practicing are exercise number 2, exercise number 3, which is walking with the mouth closed, exercise number 6, which is gentle small breath holds, and also exercise number 7, which is relaxation. And of course, you know, for you to make progress, we need to be doing about 6 by 10 minutes daily. Now, the control pose with somebody with obstructive sleep apnea, we can't always rely on it because they may have blunted chemoreceptors or they may have a reduced sensitivity to carbon dioxide. However, your results and the fact that you know you're making progress will be dependent on, is your breathing lighter? Do you feel better? Are you waking up more alert? You know, when you're doing the reduced breathing, when you're doing relaxation, is there a physiological change taking place? So ultimately, the objective is, of course, breathe through the nose and bring breathing down to physiological normal levels. It's a very, very good approach for obstructive sleep apnea, for snoring, high blood pressure, anxiety, panic attack, and, you know, any other cardiovascular, etc. issues that are there.